All right, so welcome to the Clinical AI Academy. This is the fifth journal club, and today we're discussing a short paper, but a very interesting and relevant paper for the future of medical education in light of artificial intelligence. So, the title of the paper is Artificial Intelligence for Medical Students Review of Current Challenges, Opportunities, and Future Directions. It is by Chris Paton and published in the New Zealand Medical Student Journal. So, at Clinic AI Academy, we aim to improve AI literacy in healthcare by providing high quality, open source educational, transdisciplinary content focused on artificial intelligence, neuroscience, medicine, psychology, philosophy, linguistics, and more. We invite everyone to join us because we're trying to learn by doing through open discussions, shared explorations, and reflective practice. Everyone with an interest in AI and medicine, regardless of their background or profession, is more than welcome to join our community. We have an update. We have a new contributor, a new team member, Ahmed Abu Sharh. As a new member of the Clinic AI Academy team, he'll be helping with preparation of and editing of the videos. So we'll try to keep it under 40 minutes for today, and we will continue if more depth is needed. So thank you for joining, and let's see what's this paper have for us. So I went through it. It's, as I said, it's not a very long paper, but what it does is ask interesting questions. Where is the future of AI? What is the future of medicine in light of the of AI, and will AI remain where it is, or like it's just a bubble? Particularly, I think those couple of questions are relevant for the medical students to keep in mind. So, what does this mean for medical students? So, if we reach a level where AI reaches like a level where it's performing or is as good as physicians in medicine, what do you need to learn? So, what does this mean for medical students? Will AGI or artificial general intelligence or even super intelligence, which is like intelligence that surpasses all of the collective intelligence of humanity, will it replace doctors in the future? And how will medical practice change? Or the author suggests that to keep in mind that we might enter a new AI winter instead of the AI hype, which is we're currently living in, that we'll go back to AI winters where no one really is interested in AI anymore, and this is an overblown hype of AGI, ASI will die down as it falls to materialize, so it will never happen. This is something to contemplate upon and see where it goes. So he mentions that current AI research seems to indicate that we are still on course for AGI within the next few years. So it seems that this technology is progressing, and it is progressing fast as we are seeing right now. New technologies are being developed that can overcome some of the limitations of large language models, such as hallucinations. ChatGPT can produce some output, for example, that is not there. So it's fabricating output, and excessive sycophancy. Sycophancy is an interesting term, which basically, when ChatGPT is telling you that you're doing great and this is a great answer, or this is a great question, or making you feel good about yourself to kind of gain your trust. So this can be also dangerous if it's in a situation where the user has some psychological disorders, so it might lead to dangerous behavior. So encourage dangerous behavior, basically. So large language, there are certain attempts to overcome those two very important limitations of large language models, namely hallucinations and sycophancy. However, as Jeffrey Hinton himself notes, so the author draws our attention to the issue that healthcare will always require more input, will always be in demand. So there is for healthcare has unlimited demand. And the reasons that he points out is simply aging. Humans will continue to age and get older and get sicker as they progress through life. So there is a need for increase of healthcare services. Many healthcare systems, another reason, seem to already fail and already lag far behind around the world. So we need better healthcare, and AI might help provide better and more accessible healthcare. So this means that even AI systems, even if they take over and more medical tasks, there will continue to be a role for humans. So the author sees that we will always have a place for humans in the healthcare system. So the idea of a doctor being the fount of all healthcare knowledge will probably diminish as AI systems become more reliable and informative for patients than talking to a human doctor. And we're already seeing that. You can go ask ChatGPT about any medical condition that you have in mind, and it will give you a better answer than even experts in that particular field. So knowledge wise, I think the focus for education, medical education, for knowledge, to just focus on knowledge in this education, that might need to adapt and develop more curriculum that is more practical, that encourages human interaction rather than just being knowledge or to memorize facts, because the AI will do it better than us. However, it is likely that patients will continue to want a human being to care for them in times of vulnerability and illness. That what Chris Paton thinks. Some might disagree, but with the invention of robots, and this might change, but time will tell. Anyhow, we're living in a transitional period right now. That's true. So during this transition period, medical students, what can you do? What you can do is to equip yourself with a good understanding of how AI works. That's what the author suggests in this transitionary period, that students learn more about AI. And he says, interestingly, without this knowledge, students will be flying blind in the new AI world. So students should learn about how AI systems used in healthcare have been developed. So not only know about the AI, but even how it is developed. How was it developed? Why does it work? What are the different model architectures and how do they work? So not just like, okay, I know this tool does that, for example, for stroke detection or whatever, but really know what's the model behind it, how is the architecture built. Also, the students need to know how to conduct scientific evaluation of an AI system, what metrics to use to rely upon, what metrics are important to tell you, okay, this is a good AI, that's bad AI, or that is really working for your group of patients. That's what we're trying to focus on the Clinical AI Academy videos and the clinical AI rounds. If you haven't checked them, check them also. Above all, they should consider how AI systems will impact patients. This is very important. How AI systems will impact patients. So will it benefit your patient or be a risk for your patient? They must ensure that AI systems are implemented in a way that meets patient needs. So future medical doctors need to understand what architectures are there, how they were trained, how were they developed, and to be able to conduct scientific evaluation, monitor their progress, monitor their performance over time, ensuring that they are safe for their patients and they are as efficient and meet the patient's needs. So he mentions that some medical schools are already beginning to implement courses in AI. For example, the Artificial Intelligence in Healthcare course as part of the postgraduate diploma in digital health at the University of Auckland. I'd like to mention also, for example, the course that you can take for free on the Clinical AI Academy. It's like 4 modules, directed practical use, can even assess your skills all for free. Take the course, 4 modules, have a certificate. This helps, doesn't hurt you. However, as AI become further integrated into all medical specialties, so he sees that it will be integrated, and I think that is going to happen regardless if it's artificial general intelligence or not. Even with the narrow AI that we have, it will continue to be more integrated in all medical specialties, not only radiology or pathology. It is likely that clinical educators will need to continuously update their curricula to ensure that the students they teach know how to appraise and use the growing number of AI systems that they will use to care for their patients in the future. So as the approach we're doing in Clinical AI Academy, where it is an iterative, a lot of feedback, a lot of updates, because the technology is updating and there's tons of research being published every week, and we're trying to cover at least one study per week. So that is it for this very short but interesting paper. So what do you think? How will AI impact medical education, the future of medical students? Will we even achieve AGI or ASI, or do we need it even in medicine for us to really feel the impact of AI on medical practice? A lot of questions. Feel free to answer. Tell me what you think. So the next paper is to be announced usual, I invite you to give your feedback, suggestions, join us, join the future journal clubs, suggest papers, topics, resources, contribute to the academy. It's open for everyone to, if you have something to present, an idea, a paper, feel free to reach out and we'll set an appointment and record it for you and publish it and support you. So join the newsletter on Substack to stay up to date and join us on YouTube. Thank you so much and have a nice day and see you in the next one.